to as subchondral sclerosis. Bones typically are more trabecular. You can see the really nice porous trabeculation within the medullary cavity and in the epiphysis. And then the cortex, of course, is more dense. Okay, let's talk about some common conditions in small animals. I just talked about osteochondrosis. 50% of them are bilateral, large and giant breeds. Common location, go straight to the shoulder joint, femoral head, and you see the same findings. If it is a cartilaginous lesion, you're going to see flattening, or there may be some irregularity along the surface. Everybody got that, right? Because the cartilage has not calcified. Medial femoral condyle, lateral femoral condyle, medial ridge of the talus. And these are the radiographic findings. And I mentioned to you that if a piece of cartilage has calcified and you see it, then that is referred to as a cartilaginous flap. And then you can refer to it as osteochondrosis dissecans, because that's the desiccated piece of bone. You're safe to just call it OCD, osteochondrosis. That's very safe. This is what it looks like. You see flattening of the caudal margin of the humeral head. And what would you expect to see for the subchondral bone? Subchondral what? Subchondral sclerosis. Okay, so this is normal as a comparison. Or you may see a concavity. Now, does that mean that there's nothing there because it's lucent? No, that's cartilage that has not calcified, of course. So you can have a very distinct concavity on the humeral head, or it can be just subtly flattened. All of those are signs of osteochondrosis. Here is a cartilaginous flap. Everybody see that radiopaque linear opacity adjacent to the humeral head? Okay, that's the flap. Which means then the synovium just kind of gets right under the flap and then causes it to calcify on the outside. When a piece of desiccated bone then falls in the cul-de-sac, which is in that little pouch caudally, then it's referred to as a joint body. Now, you will see in the literature it's also called a joint mouse. I put both of those there. Let's try not to call it a mouse, if you can. I mean, there's some surgeons that don't care. There's some surgeons that do care because they say there's no mice in the joint. So you're safe to call it a joint body. So what happens with, I got two questions in a minute. So what happens in a cause of a joint body is that you have a piece of cartilage that breaks off because it's desiccated, falls into the joint, the cul-de-sac, and then there's synovium there, right? It's the synovium nourishes it, and then it calcifies. And now you see it as a joint body. And then I have a question when I ask you this question.
So we're talking about OCD now, we got a test on Monday, and OCD for us was osteochondritis.
Correct. Okay, so osteochondrosis, osteochondritis, osteochondrosis dissecans, they all use interchangeably. There are two schools of thought. Itis means there's some type of inflammation, and so therefore I don't use it, and some people don't use it because it's really not inflammation, it's a cartilaginous lesion, and that's why they like to use the word osis rather than itis, and why they like to use osis rather than dissecans. So if you just say osteochondrosis, you're safe on all of those. If you call it osteochondritis dissecans, you're also correct too. It's like if it's a matter of opinion. Does that get it? No, it doesn't, because you didn't act like it did. Okay, come at me again. So,
It's just the matter of the words. So itis and otis, the different, for me it's not the same.
okay, so let me say it again. So the word itis means, if you just think about itis, it means inflammation, right? Osis doesn't have to have an inflammatory component. How do you know? You got to take it and put it on a microscope. How do you know, right? So osis is safe. That's what I'm saying. You're safe to say osis. If you say itis, you're right too, but they still use it. What you want me to say? I don't know what you want me to say, but I'm still looking at you. I got a word because I'm looking at your face.
Is that Jesus defined the same thing you did? Like a cartridge, flap, a loose background?
But it was called itis. And that's okay. It's okay. Woosah. It's okay. Just like I don't use it. I use osis because I've been corrected many times. So that's me. Use it. I sort of kind of said that in the beginning, right? Osis, you're pretty safe. If you want to call it itis, go for it. And if you write itis on my test, I'll probably frown at you. But I can't mark it incorrect because that's what's in the literature, right? How about that? I think I'm getting to you because you're smiling. You good? So, what's my take-home message? No, my take-home message to my friend right here. What's my take-home message? My take-home, my friend over here. Okay. Jose, with a J. I'm going to walk over here in his face. Who had to walk in somebody's face before? I thought we should have passed here. It was okay. Because you just love to hold your space. Okay. Go ahead. Do you spell it with a J? What does that mean? Right. And so, that's okay. You can call this osteochondritis. It's okay. Because it's still in the literature. And the thing about medicine is that there's always going to be a difference of opinion. You could be the expert, and you could be an expert, but you two could disagree. And whatever you put in the literature, that's why we have to remember so much stuff. When they always just, can y'all read the same memo and call it something the same? But people disagree. They do. And that's what you have to realize. You're going to disagree when you're working in the same practice with somebody. But you're going to come to the same conclusion on how you're going to treat it. That's the key. You're going to come to the same conclusion. Okay. Question.
My question was for you to clarify what the joint body was.
Okay. Okay, so if I'm going to ask a question, and then I'm going to define it. If I look at this, if you look at this lateral view, or see what this one, everybody looking at that one? Can you say that a joint body is not, can you say that there is no joint body? No. I got a couple no's over here. What about over here? So how do you know if a joint body is present? You see it as a radiopacity. Can you say that there's a joint body here? No. Could one be there? And why? Because it hasn't calcified. So radiographically, you can only call it for what you see. When you go in surgically, there may be several joint bodies, but you can't call that on your films because you don't see them. You just know that there could be there. All right, now, did that answer your question? No. Okay, good. Any other questions? And so what they do surgically is just go in and just move the flap. What happens is that when there is flexion of the joint, you can imagine the caudal part of the scapula hit that cartilaginous flap, and that's what causes the pain. So they go in and just clean that up and remove it. Okay, osteochondrosis or osteochondritis, I don't really care. But for this class, you're going to use O6 because you're going to be safe. So what do we see? Again, we talked about concavity or lucency. Do you see where the red marker is delineating the lucency on the lateral condyle? You know that's lateral because here is the fibula. It is usually lateral condyle in dogs and cats. On the lateral view, you can appreciate more the flattening of the femoral condyles. On that one, you can see where the arrow is pointing to. Everybody see that? And the reason why it's flat is because of the cartilage, right? You don't see the cartilage because it's lucid. Then on the craniocaudal, caudal-cranial view on the talus, it may not be as obvious, but what you look for is widening of the joint space. Widening of the joint space. I think you can appreciate that. Sometimes on that view it's very subtle, and you might not be able to appreciate it as well. But you should see some other changes on the lateral view. Okay, here's one on the medial humeral condyle, a very small lucency. And of course, anytime you have articular disease, articular conditions, articular involvement, then you would expect to see secondary degenerative joint disease. Osteobite formation to stabilize the joint. Panosteitis. You can diagnose panosteitis just from the history. Shifting leg lameness. What does that mean? Just shift from one leg to the other. Come in for the appearance of a lameness one day, send it home, comes back, it's in another leg. So what does that tell you? Because it involves multiple joints, what we typically do with panosteitis is a juvenile lesion. If you see it in an adult, that means it was there when it was young. And those are just residual changes that you're seeing. So what we typically do, if you happen to confirm it, you just take lateral views to save funds, cost saving of all the other long bones. So let's say the dog comes in with a right front limb lameness, right front. But you would go ahead and do your standard views for the right front because that's what it was presented for. Everybody got that? You go do your standard views, and then you do lateral views of the other long bones because it could be involved in multiple limbs. And the reason why the lateral is because you can see it better on the lateral view. And it's easy to position the pet in a lateral view. And you can put two long bones on one foot. Because that's why you're doing it for panosteitis, not for the examination itself. Okay, panosteitis is a diaphyseal lesion. Large breeze. And what you see could be focal, multifocal. Multifocal means multiple sites in the medullary cavity. Focal means it's just one area of opacity. When you have several in the medullary cavity, then when they coalesce, then the whole medullary cavity becomes diffuse, and that's then it's referred to as diffuse opacity. Focal, multifocal, diffuse. This is what it looks like. I apologize for this one being upside down, but you can see the opacity in the medullary cavity. That one is easy. This one is multifocal. on the femur. Can you see multifocal on the femur? Here, here, and here. What about multifocal in the humerus? It's a very easy condition to diagnose. Okay, we're going to take a break. It is on the